It is Thursday, November 4th. Welcome to the Kahnawà COVID-19 Task Force Update. This is our 148th episode. And on today's program, Lloyd Phillips, the Commissioner of Public Safety, will be here. He also happens to be the head of the COVID-19 Task Force. Just give us a little update on today's events. But before we do that, we'd like to introduce someone who hasn't been on the program before. She comes from Kahnawà Community Services. She is the team leader at the Family Wellness Center, and we would like to welcome Noreen Montour. Noreen, how are you?
I'm pretty good, Joel. How are you?
Oh, not too bad. I love your little backdrop there. It's very festive, very native looking. I love it. Let's talk about your position and some of the services that you're offering over at the Family Wellness Center to help during this COVID-19 pandemic.
Okay, so yes, I'd just like the community to know that we're located on Mohawk Trail. We offer services, counseling services. We have 3 traditional support counselors, and we're a little different than mainstream services. We use traditional teachings and we incorporate it into our counseling. So it's a little bit different than the normal counseling. We also give people teachings. We have healers on hand. We refer out to different healers that we work with. Right now we work with Mike Stand-Up and Geraldine Stand-Up. There are 2 healers that we refer our clients to for spiritual guidance. They're both available to the community, and it's quite popular. We have a lot of clients that participate in that program. Our traditional support workers also have groups. They run, we have a women's support group, and we are currently working on a men's support group coming in the wintertime. So stay tuned for more. We're always trying to find different ways to get our community involved in our traditional services in whatever way we can. So, we're always trying to think out of the box. And with COVID coming in, that really impacted our services because we know a lot of people don't like to do their sessions through Zoom. Unfortunately, that's all we can offer at this time. But I've also been learning that a lot of different organizations that do counseling and do traditional counseling have been offering services through Zoom and have been getting quite successful now. I think people are starting to realize that, we're going to be in this for a while, and, this is the only way that we have in order to help ourselves. So we deal with clients. We help them with anxiety, with depression, with anger, you name it. And we use our own traditional ways to work through this program, through the problem. And I think we're pretty successful in doing that. In our own culture, we had all the answers. And, I think it's a very relevant time to come back and use our own traditional practices. So that's what's really exciting and different about traditional counseling. I also supervise the parenting program. The parenting program, we have 3 parenting workers, and again, they're trying to rack their brains, trying to give services to the community, and trying to be innovative. And I think they're doing a really fantastic job, and having cooking shows on Facebook Live and having a parenting sessions where we invited lawyers, and psychologists, mediators to come and discuss the community's questions on supervised visits and court orders and custody. So all the relevant topics that the community faces. So, we're always trying to put in the programs that the community needs. So, we're working for you. So if you have a problem, you have a concern, or if you want us to offer some type of programming, let us know. I mean, we're here for you.
Mm-hmm. I had one question. Obviously, things have been going well. Because the whole pandemic has been creating such a different type of life for everybody. It's no longer Monday to Friday, then here comes the weekend. For some people, 7 days a week, you can't tell one day from the other. Are there services available on the weekend, or is it basically at this time mostly a weekday kind of thing?
Generally speaking, it's during the week, but we have been very flexible to meet our clients' needs. For instance, if someone works, like say in the States, and they come back on the weekend and they need counseling and it's over Zoom or by the phone, we can meet their needs. We've had appointments in the evenings, early morning, lunchtime. Our workers are so flexible in trying to meet our clients' needs.
All right, well, that's excellent. Is there anything else you'd like to add, Noreen, before you head off?
Just if anyone wants to get in touch with or wants to participate in traditional services, you can contact KSCS Intake at 450-632-6880. You can ask to speak to the intake worker and request traditional services. This goes the same for accessing Mike stand-up and Geraldine stand-up. If a community member wants to access their services, call intake, request to meet with Mike or Geraldine, and they will set things up, and a receptionist will call you back for an appointment.
All right, well, thank you so much, Noreen. This has been excellent. A lot of great information today, and hopefully you'll have a great weekend, and just keep doing the good work that you're doing.
All
right, Onagiwahi. Well, up next, we have, as promised, the Commissioner of Public Safety and the head of the COVID-19 task force. So once again, let us welcome Lloyd Phillips. Lloyd.
Thank you, Noreen. I appreciate your appearance on Facebook Live. It's good to show the community, a lot of the services that are available in the community. Obviously, KSCS plays a major role in psychosocial support and mental health in the community, and that's just one example of the many services that are provided. Because mental health and psychosocial support kind of has been the theme that we've been discussing a lot over the past a week or so with the task force, recognizing that obviously it is a major component moving forward. And we have to look at that much more closely, and how the ongoing pandemic impacts people not only physically but spiritually, emotionally, and mentally as well. And these are some of the things that we are looking at much more closely. We're pulling in more experts to help guide the task force, to help bring better balance into any decisions that we make, to ensure that we're looking at both sides equally. Obviously, the mandate of a task force and our primary goal is to limit the spread of the virus as much as we can. But at the same time, we have to make sure that we balance off this psychosocial needs, emotional support, and stuff that the people maybe require in the community. Because as Noreen mentioned, we all know we're in this for a while still, and it's unfortunately, but that's just the reality, that we can't put a period somewhere on this and say at this point in time things will be back to a more normal state. We have to take it week by week, ongoing assessments of where we are, and seeing what can be done in terms of measures, modifying measures, reducing measures. And unfortunately, there may be a time down the road where we may have to increase. But we're taking it day by day, and certainly increased restrictions is not something that we want to do or look forward to doing. But again, if it's a requirement to limit the spread and protect our people, the tough decisions will have to be made at the appropriate time. That's just wanted to update on that point. Because I'm sure many people have heard, there has been another case in the community, established a positive in the community, and that certainly does send ripples in effect throughout the community, and it certainly impacts the person themselves who is infected, and certainly their immediate family and their close friends are also impacted hard. And that we have to keep in mind, that this virus is an invisible enemy. It could impact anybody. Nobody's to blame, if you do get the virus. It could happen to anybody. Even if somebody's being protective, and we talk about the hygiene, masking, and distancing as the cornerstones of keeping yourself safe. But sometimes it could be something as simple as touching an object and then touching your face a couple minutes later and potentially infecting yourself. It doesn't necessarily mean somebody was being neglectful of any measures or any directives because they get the virus. No, so I don't want to see our community get into a position where if somebody is positive, that it's looked at as a negative. And as a matter of fact, people who are I know for a fact, people who get infected are going through a major crisis in their lives and their family, and they're scared and they're not sure what the outcome will be. And so that's the time they need the most support from community and their families. So I certainly hope people look at that moving forward, because unfortunately, the way things are progressing throughout the pandemic and where we are now in early November, we're more than likely going to have more cases in the community. To say we're not going to have any more cases would be unrealistic. Obviously, our goal is to keep it to a minimum, but certainly there will likely be additional cases as we move on throughout the winter months. And I'd like to see our community be supportive of individuals, if and when they become infected, because despite our differences at times, we all are a community. We're all Kahnawake. We're all Mohawks of Kahnawake, so I think it's important that we keep that in mind first and foremost. And our community, our families, we're all here. We're all in this together. And it's only through our cooperation, mutual support, that we'll get through this together. That's all I have for today, and I'll leave it there, and I'll talk to you again soon. Onigawahi. Take care.
Nyauko Lloyd, and thank you very much. And like Lloyd said, short and sweet. Remember, the numbers are still high in Quebec. It was still over 1,000 today. And just one of the notes of, if you've been paying attention, it's been a good couple of weeks since the numbers have been that high. But over that time, the number of deaths has continued to increase. At the beginning, it was about 3 or 4 a day, and now it's over 30 in the past few days. So we still have to always take care and wash our hands and wear the masks and keep the social distancing. And we'd like to thank, by the way, Noreen Montour again from Kahnawake again has Community Services for some great information there. She mentioned that you can call them at 450-632-6880. But after hours, if you ever need to talk to somebody to unburden yourself or whatever the case may be, they're still available, but you contact the peacekeepers first, and they will put you in touch with someone who can help you out. And the peacekeepers, of course, are at 632-6505. So with that, we'd like to thank you for taking time to join us on this date. No matter where you're listening from, take care of yourselves, and we shall see you next time. So on behalf of everybody at the Kahnawake COVID-19 Task Force, Nyauko Adano, Onigiwahi.